I thought it was a wonderful program, very diverse. I think it just demonstrates what a broad interest there is here at the institution in reproductive biology and reproductive health in general. I think Dr. Lamb is providing superb leadership to the center. We're just very proud of what's being done here at the center, and we feel like it was a wonderful idea to create it, and the evidence of its effectiveness and its contributions is just really extraordinary. It's a real showpiece of what Baylor has to offer scientifically and clinically.
So today, Reproductive Health Day really celebrates, I think, the achievements of scientists working in all aspects of reproductive medicine. And so our specialties really go throughout the entire lifespan and encompass things such as not only urology and obstetrics and gynecology, but also departments such as molecular and cellular biology and pathology. And in fact, the membership for the Center for Reproductive Medicine includes members from every department at Baylor except for 2.
I'm actually a new member of the center. I've only been participating over the last 6 months, but even in spite of that, I've been really excited about this particular research day. The level of organization and the quality of science that gets presented at the center and what I've heard today is phenomenal. It's by and large some of the best work that's being done at the college. I think what I've liked the most about the day has been the variety of research that we're getting to hear about in the center. It spurs my own thinking, and I think it really makes my research more full to see what others are doing, not only related directly to my own goals and my own research, but also how I can maybe take the work of others and utilize that to move my own research in new and different directions.
Well, that's one of the actually good things of science. You have the ability to collaborate with other bright people. They may have models or ideas that you can utilize in your own experiments. That is a way of greatly accelerating research rather than you sitting in a little isolated lab and doing every single thing and thinking of everything yourself. And Baylor is a place where there's excellent cooperation between scientists and departments.
So I think that Reproductive Health Day activities are really sort of culminated in the interactions of the individuals. Again, our goal is to have our members synergize, to have the whole be greater than the parts, and we do that really by interacting and networking and learning who our colleagues are. Many of the times we're spread throughout the medical center, and so we may not meet people from TCH or some of the other institutions, all of whom are Baylor members.
I think there's a real benefit of being part of the center. It's just a great collaborative community, and there are so many people with varying interests around reproductive health that it really makes for, it creates interesting opportunities for collaboration. It also expands your sort of knowledge base because you're hearing things and you're interacting with people that you might not otherwise do in your daily work life. I think the importance of sharing research is, sometimes we work in such silos that it's difficult to put your work together with what other people are doing, and it's only when you have sort of that broader perspective you can put things together and make new discoveries, and you can look for opportunities for collaboration that you may not have thought would have existed.
Oh, I've been really impressed with the work I've seen today, particularly with the younger people. There's a lot of hardcore, rigorous science that's being presented here. I'm very impressed. This event has been invaluable for networking. I'm at Baylor, but there are an awful lot of people who work at Baylor. I don't have a chance to meet everybody and talk to everyone about where our research interests might overlap. And today I've had that opportunity almost all day long. I know I've gotten a few people thinking about how their research could maybe apply in a spaceflight mission, and that's just fun for people to think about.
Membership in the Center for Reproductive Medicine has increased exponentially over the past 5 years. We now have 234 members, and that membership is growing rapidly with each day, and I think this is because we encompass all areas of life, from fertilization to death, and we seek to both prevent those problems from occurring and to seek cures for those problems.
If I was telling a friend why they should come to Reproductive Health Research Day, I would say you've got to come because it's going to really transform your research in a way that you don't even anticipate.
I'm really looking forward to next year because each year I'm impressed with the progress that's being made, and I just think that we have limitless possibilities to add to the field and address the critical clinical issues that patients deal with and are very challenged by.